Good day everyone, I am Doran Joanna Marie from BSN2 Section 12N from Davao Doctors College, and today I am going to perform a third demonstration of a parenteral such as the intradermal, intramuscular, and subcutaneous. So first we will going to check the doctor's order here because firstly we must check the doctor's order. This is to ensure that the patient receive the right medication at the right time, and checks the medication administration record or MAR, checks the medication administration record to drug name, dosage and frequency and route of administration, and the expiration date of administering the medication. So now checks on the label medication carefully against the MAR to make sure that the correct medication is being prepared. And now follows the 3 checks for administering medication, and read the label on the medication. First is when it is taken from the medication card. Second is before withdrawing the medication, and lastly after withdrawing the medication. So before the procedure, we need to prepare all the materials needed, and prior to conduct the procedure, we must wash or sanitize our hand. And since I'm done washing my hands, now I'm going to sanitize my hand with an alcohol. So before doing all the procedure, we need to introduce ourselves to the client and as well as the procedure. Good day, ma'am. I am your student nurse for today, and may I see your wristband? And please state your full name. Okay, and your age and your birthday. Alright. So prepares the medication vial for drug withdrawal, and since I have here the materials that we will going to use, and now mixes the solution if necessary by rotating the vial between the palms of the hands, not by shaking, because some vials have contains aqueous solution which settle when they stand, and shaking is contraindicated because it may cause the mixture to foam. Now remove the protective cup or clean the rubber cup of a previously opened vial with antiseptic wipe by rubbing in a circular motion. The antiseptic cleans the cup and reduces the number of the microorganisms. Here. And discard. And now withdraws the medication, attaches an aspirating needle as agency practice dictates to draw up premixed liquid medication from multi-dose vials, and ensure that the needle is firmly attached to the syringe. And now remove the cup from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be drawn up. And now carefully insert the needle into the upright vial through the center of the rubber cup, and maintaining the sterility of the needle. Since I'm done doing it, now inject the air into the vial, keeping the bevel of the needle above the surface of the medication. And now withdraws the prescribed amount of the medication using either of the following methods. And since I'm done putting the syringe into the vial, now I'm going to hold the vial from down, example with the base lower than the top, and move the needle tip so that that it is below the fluid level, and withdraw the medication. And insert the vial, ensure that the needle tip is below the fluid, and gradually withdraw the medication. and we will going to shade a black ball pen at the site. So good day everyone, and now I'm going to perform the subcutaneous injection. So perform hand hygiene and observe the after appropriate infection prevention procedure. And since I'm done washing my hands and sanitizing, now I'm done gloving, and provides the client privacy and prepares the client. So prior to performing the procedure, introduce self and verify client's identity using agency protocol. Because prior to performing the procedure, introduces self and verify the client's identity using agency protocols. So how do you want me to call you, ma'am? Before that, good day. Good day. I am your student nurse for today. May I see your wristband? And please state your full name, ma'am.
NG Fabrica.
And your age?
20.
And your birth date?
July 30th.
Okay, thank you, ma'am. And now we will going to assess the client to a position in which the arm or leg or abdomen can be relaxed depending on the site to be used. And assist the client to a position in which the arm or leg or abdomen can be relaxed. So I'm done assisting my patient into a sitting position because she relaxed at a sitting position. So now obtains assistance in holding an uncooperative client. And if the client is uncooperative, we need assistance in holding the client to prevent injury due to sudden movement. So explain the purpose of the medication and how it will help using language that a client can understand. Includes relevant information about effects of the medication. So ma'am, today I will be injecting an insulin to you. It will be regulate your blood sugar level, which can reduce the risk of complication with your diabetes, and can also help you feel better and have more energy. Would that be okay with you, ma'am?
Yes.
Okay. So now we're going to select and the clean site. So select a site free of tenderness, hardness, swelling, and scaring, itching, and burning, or localized inflammation. Select a site that has not been used frequently. Okay, ma'am. So, as agency protocol indicates, clean the site with antiseptic swab and start at the center of the site and clean it, widening circle to about 5 centimeters, and allow the area to dry thoroughly. And now, place and hold the swab between the third and fourth fingers at the dominant hand, or position the swab on the client's skin about the intended site. And now prepares the syringe for injection. Here, and remove the needle cap while waiting for the antiseptic to dry, and pulls the cap straight to avoid contaminating. So injects the medication and grabs the syringe into your dominant hand by holding it between your thumb and fingers, with palm forcing to the side or upward to 45 angle insertion, or with the palm downward to a 90 angle insertion, and prepare to inject. And now, using the non-dominant hand, pinch or spread the skin of the site and insert the needle using the dominant hand, and firmly steady push. So now When the needle is inserted, move your dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to the end of the plunger. So, injects the medication by holding the syringe steady and depressing the plunger with a slow and even pressure. So removes the needle and removes the needle smoothly and doing the line of insertion while depressing the skin of your non-dominant hand. And if bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. And disposes the supply appropriately and assist the patient into a comfortable position, flip down and medication ticket if not using MER, and do after course, remove gloves and use hands in appropriate ways, receptacle, return the equipment to its proper place, especially the MER machine, and perform hand hygiene and assess the effectiveness of the medication of the time it is expected to act, and document all the relevant information. Discard. Then sanitize our hands. And that's all for my return demonstration.